And we're back.
And we're back.
So, to start off like we always do, what are we drinking?
So today we're drinking a little bit of Bailey's and hot cocoa, a holiday treat today, man.
Cheers.
Cheers. Wow, magnificent. So, Sonny, what are we talking about today?
I can definitely taste that Bailey's. So, we are taking it back to one of our health news episodes. And the first kind of topic that I think we should talk about is Oregon.
Okay.
So, Oregon is trying to be the first state to develop a universal healthcare plan for its residents.
Right. Wow. So what does that mean for the residents? Universal healthcare plan. We hear it, but what does that mean?
So it pretty much means a state-sponsored plan that is, in one caveat, affordable.
Okay.
That provides the same benefits as a state employee would get if they were getting the health benefits. And the big thing is that every resident and every citizen of Oregon would be able to access it regardless of their income.
Wow, that's amazing. You know, Oregon has had a really positive history of progressing different things. Healthcare and having a universal healthcare is only one. They also made it so that they decriminalized people who were caught with drugs and people who were kind of recognizing that addiction is a health concern. So instead of spending the money to put people in jail, they spent money to give resources to prevent and cure people of their addictions.
And that just takes it back to the social determinants of health and the fact that if you invest in the communities,
exactly,
instead of the prisons and the consequences of actions and help prevent those actions, you have much better outcomes.
Wonderful, awesome. Can't wait to see what they do with that.
Yeah, their joint task force started in 2019 and they just published this 223-page report with guidance and recommendations and kind of some logistical topics on how to actually make this happen.
Yeah, maybe we'll see people follow suit.
Hopefully soon.
Awesome.
And then, we kind of are going to dive into our next topic, and it's on the other spectrum of the news. So, people have been talking about this viral TikTok.
Oh, TikTok.
Whew. Oh, TikTok. TikTok and medicine.
Yeah.
So, this TikTok went viral about these labor and delivery nurses. And they were talking about their icks.
Yeah, and some of their icks that they were talking about, Sonny, were things that were saying, one of my icks is patients coming to the nursing station asking for a blanket.
Yeah.
Or patient just had a baby delivered. What's the way the baby's still in my hand? My goodness.
So there's, I think, a lot of things wrong with the video. First of all, the fact it was made.
Absolutely.
And the context it was kind of made in.
Right. And you think about it, and people who are in the hospital, regardless of reason, are at some of the most vulnerable points in their lives, and asking for things in comfort versus or asking for anything. And the reason why you sign up for to be a healthcare provider is to help people, right?
Mm-hmm.
Like that's the main point, is to help people in their time of need. And a patient, it can be very scary giving birth. You just never know what that patient's been through.
Yeah, exactly like you mentioned. And if any of those patients ever feel like they can't ask for help or they're uncomfortable because they're scared of what their nurses or anybody on the care team would think, it just causes detrimental outcomes.
Yeah, that type of behavior just sets us back.
Yeah. So those 4 nurses actually were fired.
Wow. Yeah, I get that.
Do you think it was justified?
Yeah, some of those things you join healthcare, like I stated, to help people, and the snarky comments like that, it just doesn't promote a good work environment, and it doesn't promote a safe environment for patients. So I understand the administration's decision.
I 100% agree. I think once you start talking about mistrust in healthcare,
exactly,
it's a slippery slope.
Absolutely.
And when you're employed by a health system, in this case it was Emory, they have the right to, in my opinion, when you start making patients question your intentions when they feel uncomfortable in the care that you're providing.
And you have a certain code of conduct you have to act by. We're professionals.
And filming it at work.
Yeah. Poor use of time.
Yeah. Well, I think the big caveat is social media medicine can be really beneficial in terms of education, connecting with others.
Absolutely.
And coming together in our mutual understanding that insurance companies are awful.
Yeah.
But speaking of large companies that profit a lot of money, Amazon.
Oh, Amazon.
Just launched Amazon Clinic.
Amazon Clinic. So Amazon Clinic is an area where people, instead of going to their primary care doctors, they can log into Amazon Clinic and address quote unquote smaller issues and problems, like for instance, seasonal allergies or acne, depending on the type of medicine. There are some limits to that. Also, they can address things like refilling asthma medications, things of that nature. And it gives people a quick and user-friendly way to see a provider, whether it's a nurse practitioner or a licensed physician or a physician assistant, and kind of solve that problem in an hour.
Yeah, so I was about to say, like, it's a chat-based service, and what are the typical wait times, and do they have a cost associated with it?
Yeah, typical wait times are either under an hour or under 4 hours for a lot of the different services that are there that you can pick from. Wow. And the typical cost is about that of a copay. That doesn't include the medications, but that is about that of a copay, about $40.
So, insurance won't pay for, or Amazon Clinic will not accept insurance, but any prescriptions that you have can be filled through Amazon Pharmacy with insurance.
Absolutely. So you can fill your prescriptions through Amazon Pharmacy. They also allow you to, if you have your own home pharmacy or someone that you're comfortable with, whether it's a CVS, Walgreens, or a local individually owned pharmacy, they can send it there electronically.
Wow, that's fantastic.
Yeah.
I think the goal is to really reduce the burden on healthcare of things that can be handled that don't always necessitate an appointment and a full visit.
Absolutely. But the takeaway point from that is, Sonny, the fact that in the event of an emergency, go to the emergency room. In the event of a chronic issue that you may have that's not resolving, see your PCP. So it's not at all to replace your primary care doctor or the ER, but it's a supplement.
I think that's an incredible, ending point. The ED is always going to be the go-to if you start having chest pain. And
exactly. Just know that the emergency room can do a lot more for you than someone on a chat. But if it's something mild and you have a busy lifestyle, like you're a busy professional, and you just need something for your seasonal allergies, think about trying them out.
Yeah, I think there's a place in healthcare for things like Amazon Clinic.
Absolutely.
Speaking on, and we can cut this out but did you see that Cleveland Clinic is going to start charging for Epic messages?
No, I did not see that.
So I actually experienced this a lot.
So wait, let's start there. What's an Epic message?
Yeah, that's actually a great point. So Epic is a electronic medical record software that a lot of health systems and physicians end up using.
Okay.
It is where patients have access to their entire data, but it's also where physicians chart and bill for.
Okay.
Or use it to bill for their services. So Epic actually integrated a chat feature and a messaging feature so that you can inform patients of their labs so that they could have access to all the records, but it also allows patients to reach out to a provider or a nurse, one of their providers or nurses, in a more informal way, but that's still recorded by the electronic medical record.
Okay, gotcha.
So what a lot of people have been seeing, though, is that a lot of these Epic messages should be visits, even at minimum telehealth visits. It'll be like, oh, I have a new rash on my leg, and that's concerning for cellulitis, or something like that. And so in one way, it is, decreasing the burden of clinic.
Right.
But in the other, it's actually contributing to it, because if it's something simple like, oh, I need a refill on XYZ medication, done. Right? That doesn't need a visit, especially if it's a chronic issue. But if it's, hey, I have this new problem, can you diagnose it for me, and everything over Epic message?
Yeah. And Sonny, that talking about this just makes me think about the reason why healthcare can never be fully virtual. A lot of what we do is hands-on. We have to see the patient. We have to do our physical exam. That tells us in so much information that some of these Epic messages do have, like you said, a right place. Like, oh, I'm having some issues. My diabetes medication is running low all of a sudden, or it fell down the drain or something of that nature. But when it comes to new issues, rashes, pus, things of that, it needs to be a visit. We have to do our physical exam and assessment, and at minimum, a telehealth visit, not just a chat.
Yeah, and the big thing is that a lot of times epic messages, such as we were talking about, you can't bill for them.
Right.
And so the provider and the health system are occupying or taking up their time.
Right.
So, you know, sometimes it's
Right.
almost 5
Absolutely.
minutes, but sometimes it's a whole 30-minute, 40-minute visit or conversation that ends up turning into a visit.
Yeah. And then also, you know, we tell patients if these things happen, whether it's redness, pus, or you see things, you get pain, to go to your ED or call the clinic. And those epic messages could also get a little lost in translation. You send an epic message on Friday, you might not have a reply until Monday, and that might be too late.
Exactly.
So,
Well, I mean, it's been a great little recap episode.
it's been a great episode.
Yeah.
Great year.
We'll be doing another episode to kind of recap the ending of 2022 and the entire year for us as people, as our podcast, and we want to highlight the winners and losers in our opinion.
2022 wrap up.
Yep, coming soon. Thank you guys.
Thanks, everyone.